Hi, everyone. I am Sonia Dolan. I'm one of the co-founders of Mettle Health, and today I'm doing a little mini Mettle interview with one of our wonderful counselors, Claritza Rios, who is going to introduce herself as well. Claritza, hi.
Hi, everyone. My name is Claritza, and I am a physician counselor here at Mettle. I am emergency medicine, internal medicine, and palliative care boarded. Three specialties that I feel really passionate about, and have been practicing medicine for several decades. I'll stop there with aging myself, um, but have been all across the healthcare landscape, primary care, emergency care, and chronic care management. And so feel really lucky to have had that experience because it really does inform how I support the metal folk.
Oh, awesome. I love your certifications, I'll call it that, because I'm struggling to find a better word, of ER medicine and palliative care medicine. And I'm
Yeah,
wondering if you can talk about how you find that those combine when you're speaking with people, either at Mettle or, elsewhere in your life when you're counseling families and patients.
yeah. So it's funny because people think of emergency medicine as being kind of the opposite
Yeah.
of palliative care. Emergency medicine is identify the problem, address it in real time, and move on because you are the doors to healthcare in the hospital or in the community center, et cetera. And so, um, palliative care, on the other hand, is this like, um, let's go slow to go fast. So let's really get down to what's at the core of our symptoms, our feelings, our emotions, et cetera. And how can you switch it on and off, and how can you do both? And I think that as an emergency medicine doctor, the um, beauty of EM docs is that we have to build trust and rapport really quickly, and we need to move quickly to address people's needs. And obviously, I believe that internist surgeons and other folks can do that as well, but we just have to do it at work. Like that's part of the job requirement. And you have to do it day in, day out, patient in, patient out. And so I think that is not like opposite, or like it's a beautiful juxtaposition of like
Mm.
having to be this person that engages people quickly and builds trust quickly, and sort of the longer term relationship that maybe you have when you do palliative care. I also think it's fantastic in the work that I do because I have been in the ER and I've dealt with chronically ill folks. I've dealt with like folks getting bad news, having to deliver bad news to their family members, having to pivot in care, having to coordinate care with multiple teams as you're navigating a serious illness diagnosis. And of course, I've done it as a physician, but certainly have leveraged those skills in my personal life as well with my loved ones. And so I think they complement each other really well.
I love that. I hadn't even thought about the immediacy of having to make a connection with a human being who's coming into an ER situation in crisis, stressed out, and you have to be the person who connects with them in order to get information and find a path forward. Like I hadn't even thought about that, and it makes so much sense. And the other reason I think this combination makes so much sense to me is knowing that people on hospice care, people receiving palliative care for terminal or serious illnesses do end up at the hospital a
Yeah.
lot of times. Like they're not disconnected. It's not just the second you get on hospice, you're never going to the hospital again. Or if you've got a treatment plan with your oncologist that you're never going to the ER, like these things show up all the time. So having someone be able to set that expectation of, okay, if you do have to go to the hospital for uncontrolled pain, here's what to expect. I mean, it seems
Yeah.
like it makes a lot of a lot of sense.
Yeah. And I think one of the things that came up for me as you were saying that, I was like, oh yeah, is, and partly because I had a recent conversation with a parent that my goes to my kiddo school. You can say the ER is a crazy place, da 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 da, but there's something to be said about like No, I've been there. Like, this is what you can expect. This is what the
Mm.
lights look like. This is what the experience is like. Um, and so, yeah, I think that that also is just helpful information to have in general. Um, so yeah.
Yeah. Well, expectation around a space, to me, the ER is a scary space. Like the ICU, the ER is a scary space. So having someone, like you said, to kind of say, this is what it's going to be like, it will feel weird or it will feel discombobulated. That's real. That's true. I think helps a lot because you're already in this crisis mode and then going to this place that you know nothing about. Um,
And this is how you advocate for yourself so that you feel
yes.
safe, so that you
Yes.
feel like, okay, in the chaos, I know, oh, okay, I know that the nurse is going to come in, or that this is going to happen, or that this is what happens when you get admitted to the hospital, etc. Um, and that's really helpful, I think. And I think as clinicians, we take it for granted because we've been in it for so long.
Hmm.
Um, and yeah, I was taking a cooking class once, and the gentleman said julienne this, and I was watching the Food Network enough that I knew what julienne meant, and but the person I was taking the class with didn't, and he's like, ah, I've just been doing this for so long that I just assume, and I'm like, I do that in my job too,
Yeah.
and I'm the one that's not supposed to do that. So I think, yeah,
Yeah. It's a natural inclination. I'm
100%.
hoping you can speak to us a little bit about where the moments in your clinical work or care work where you feel the most fulfilled or like, yes, I love what I do. This is it.
I think for me, so many things. Um, I think helping people understand the arc of illness, I think
Mm.
it's helpful. W- Helping people understand what's in their control and what isn't in their control, is also really helpful, partly because I feel people put a lot of pressure on themselves to kind of like, oh, I have to gain weight. I have to tolerate X or work with Y. I have to, if only I can do my physical therapy, you
Mm.
know? And I love stepping into a conversation and really speaking to, well, okay, let's take a second. We can be rah rah till we're blue in the face, but if your body is not in a position where it can do these things, then, can we talk about that a little bit? And just exploring the emotions there, I think it's really helpful. But more importantly, is for people to not, helping people not put undue pressure on themselves, um, especially as like head of household, partner, this multi-faceted human.
Mm.
Like, let's not add to the pressure of having to be the good patient. Um, but I think that the most important thing for me is bringing the village together.
Mm.
So families, friends, loved ones, chosen family, biological family, they're people, supporting the caregivers and loved ones and navigating chronic illness with this person, and being part of the crew on the ship to, uh, you know, comfort, for the destination of comfort, destination of cure, whatever it is. But I do love bringing people together and sort of kind of getting everybody acclimated, and help people figure out how they can best support their loved ones while at the same time deal with their own feelings about
Mm.
about what this illness does to them or impacts them.
Yeah.
Um,
Do you find that having those conversations with like a bigger group gets to that goal versus having lots of little ones? I mean, I think that's something we advocate for a lot is kind of getting everybody into the room and having a discussion with them.
yeah, I think so. It's a funny thing because obviously loved ones, families. I'll use this general
Yeah.
from family,
Yeah.
but I mean chosen or otherwise. Um, Everybody's different, and so sometimes you do need to do some pre-gaming, sort of like who's what, and do what I call get the situational awareness. Like, what's the beef that this sister has with that sister that is impacting the way they support this sister, and everybody's wonderful and great, but we all have those skeletons in the closet that make us react to stress differently, right? So definitely think that getting situational awareness is important. You can explore that in a big room sometimes, and I'm always happy to be that agent of exploration, or dropping a bomb if I have to. Sometimes
Right.
that does happen, but we're trained to manage that. Um, or having individual conversations to then come together and prepare people. And I think that that's one of the things that at Mettle we get to play with, is sort of help me understand how your family structure is and how things work. So then I can pregame with you and say, no, we can just do this in a big group, or hey, let's meet with that person that's like having a tougher time separately,
Yeah.
and then we can come together. But I do think that as providers, as physicians, as counselors, like one thing we can do is hold space and support and treat the whole um, the whole network of people that are supporting the ill person,
Mm.
partly because there's a legacy. I call it, when I do my health equity talks, I talk about this, the concept of what remains when a patient dies or has um, a huge uh, um, disastrous or dramatic or difficult situation happen, or if somebody dies in a way that was unexpected. There's family members that remember what was said, what was not said, how they were
Mm.
treated, how they were not treated, and it peppers their healthcare decisions down the line. What
Yeah.
they tell their kids, what they say about that hospital, about this type of doctor, or about nurses, or the PCAs in the room, etc. And so, yeah, it's a privilege and a ton of responsibility to do that right, because it's the ill person, but it does affect the way that all the folks that are in that network are gonna react to healthcare folks
Yeah.
in the healthcare
Yes.
system.
Yeah, totally. I always like using it as an excuse of like, you be the family and let us take on the role of like having this conversation and leading it, so you don't have to worry about being the moderator. Like,
Yeah,
have someone else who is able to turn to the next person and say, did you hear that? Like, what do you think about that? Versus you being that person, which then can, I think, exacerbate, like you said, roles, and like, this happened 20 years ago and now in this conversation it's coming up. So it's nice to just hand it over to someone else and be like, you be responsible for taking care of this
100%.
and we'll just be ourselves. Yeah.
And when I said before, the dropping the bomb, sometimes if you are the family spokesperson, to have that role seems unfair, undue pressure,
Right.
because then even though you're just the messenger, you it's human nature to identify you as that spokesperson with the bad news or
Yeah.
the decision. Like, I can't help but think of person X, and if we can um be the bad news bearer, it's so much better for
Yeah.
everybody, so that
I
people
agree.
not only can not be distracted by the doing role,
Hmm.
but
Right.
also then the others don't feel like, wait, it was Uncle Johnny who said X, Y, and Z, and I can't help but shake that.
Yeah. Yep. Yes. Yes. Amen to all of that. Well, thank you for a very short little interview with me. I appreciate it so much. Thank you for being with us.
Thank you. It's wonderful. Take care.